Russia is claiming victory in the worldwide race for a coronavirus vaccine. The government is clearing a vaccine for use despite not putting it through a third round of testing on humans. President Vladimir Putin insists the vaccine is safe and says one of his daughters has been inoculated. Mass inoculations could begin as early as October. Freelance reporter Dan Ashby is in Moscow with more on today's announcement. So, Dan, what can you tell us more about this vaccine?
Hannah, President Putin says this is an important step for the world, and he's so sure about this vaccine that he's even tested it on his own daughter, says she remains stable, she was stable, reacted fine, and he has trust in it, and that Russia has done the necessary tests. But the controversial thing here is that Russia has leapt ahead in registering this vaccine, even though those all-important, wide-scale human testing has not occurred. So we've spoken to the Association of Clinical Trials Organizations in Russia, a major scientific body here. They say that they believe it's only been tested on around 76 people. That's the numbers they've got. And by this stage, it should have been tested on tens of thousands of people. And just to give you an outline of their concern, they said we have nothing to be proud of in Russia. It's more of a shame that the country demonstrates it's willing to violate common rules and cut corners just to demand rewards. Of course, the government, though, denies that. They say they have simply fast-tracked regulations because it is ready and it is worthwhile given the scale of the pandemic. But they've given it a name already. They've launched a website. It will be called the Sputnik vaccine, like the famous satellite that was launched. And I think just like the satellite, the half the world will wake up being hugely excited about it, and the other half of the world will be looking at this with concern.
Yeah, so let's talk about that. What's the international reaction?
Well, it's been interesting. It's been so mixed. On the one hand, you have the World Health Organization really raising eyebrows, saying, look, this shouldn't be happening. You have to complete those phases before you register for the safety and effectiveness of these vaccines. You also have a lot of skepticism from the US, and I think Britain will be concerned too, given that just a few weeks ago they were talking about alleged hacking of their vaccines from Russian cyber criminals. But then you get the likes of the Philippines coming forward and saying, hey, look, we want to be part of mass trials, send the free vaccines over to us. And this website going live saying that countries such as South Korea, India, Saudi Arabia, Turkey, they all want to be or are showing interest in both production and trials of this vaccine. So a huge story for Russia. Controversial that it's leapt ahead with this without completing the trials, but a major moment. And I think Russia is saying to the world, we think it's justified.
Okay, Dan Ashby in Moscow, thanks for your report. We appreciate it. For more on what we just heard, I'm joined by Dr. Zain Shagla. He's an infectious diseases specialist at St. Joseph's Healthcare in Hamilton, but joins us from Mississauga. So thank you for joining us on the program. Let me just get your thoughts. What do you think of this vaccine?
Yeah, I mean, there's a huge concern here. The phase 3 trials, which are completely missing in this vaccine, are what really show this vaccine is safe and what shows this vaccine is actually effective. All they've done to date is injected a number of people and seen if their immune response was normal, but that's not enough to say that this is a vaccine that's effective in large-scale populations or safe in large-scale populations. So there's a significant concern here if this is being rolled out to people without that type of consent. And, there is the possibility that this vaccine doesn't work or it even causes harm, which just puts us back even further.
So we heard in that report that it's likely only been tested on about 76 people, including supposedly the president's daughter. I'm not sure what you think of that. But when it goes through the approval process, it has to be tested on tens of thousands of people. Is that right?
Yeah, so essentially we have phase 1, phase 2, phase 3 trials. So phase 1 is just saying that the dose is right and it's relatively safe in a small number of people. Phase 2 is you're giving the doses to more healthy volunteers. You're seeing their response that it works, but it's still a small number. So if you talk about 76, if you saw a very major side effect in 0.5% of the population that gets this, that 0.5% would have a significant side effect or could die from the vaccine, not that that's ever been shown, you need to give it to 200 people to actually see that side effect once. So, a trial of 76 people, it's very dangerous to scale this up to an entire population without doing those trials of tens of thousands to get some of those rarer but very significant side effects to show up.
So let's talk about phase 3 because it hasn't gone through the phase 3 process. How important is that phase to the approval process?
It's huge, and this is what the Moderna vaccine is going through, the Pfizer vaccine is going through, the Oxford and AstraZeneca vaccine are going through. You have to scale it up to a large number of people. We do these phase 2 trials, the prior trials, looking for an immune response to the vaccine, but that doesn't necessarily always add up to protection. So what we may see from some of these phase 3 trials of the drugs that we're very interested in right now is that their effects aren't replicated when you do a large-scale study, or there is a side effect from the immune activation of these vaccines. So they're hugely important. I mean, this is the basic standard for any pharmaceutical compound that comes to our market, that it's gone through this safety and efficacy analysis. So, this is just a big cut to the scientific method and to the safety of our patients and to our public health systems.
Well, it sounds like then what Russia is doing is using its people as the phase 3 trial of this vaccine then.
Yeah, and how we register phase 3 participants is we give them informed consent. We tell them that we don't know all the risks and benefits. We watch them appropriately. We have very, very strict guidelines into monitoring them. We monitor for every symptoms. We register them for their long-term follow-up and follow them up to a certain period. We screen them for any other issues that might be an issue with the vaccine. It doesn't sound like any of this is being done. If you register the vaccine and you allow it to be given to people in mass quantities, you're kind of doing what we call phase 4, which is the real world analysis of what's going to happen. But without that phase 3 data, those strict kind of very controlled populations, you're not going to see if there's a problem that's going to happen early. You might see it much later down the line.
What do you think of the fact that other countries are saying, yeah, sure, let us try this vaccine as well?
Yeah, I mean, the vaccine issue has become such a politicized and an economic issue in a sense, where you have a number of countries already bidding for vaccines that haven't gone through their phase 3 trials. There are probably a lot of low and middle income countries that have been left out of some of those vaccine wars and vaccine talks, that getting to anything on the market or getting to trial anything on the market is something that's appropriate in that sense. And so I think that's the problem here is that there's no huge guarantees that if a vaccine comes to the market, it's going to be distributed equitably amongst the entire population of the earth. And so you have countries that are looking at a target and saying, hey, wait, we lost on these other 4 ones. Let's go to this one and see what happens, just so that we have a foot in the game when the time comes.
Okay. Dr. Zain Chegla, I'm sorry I'm going to have to end it there. I could continue on, but we appreciate your insights.
All the best. Take care.
Dr. Zain Chegla is an infectious disease specialist at St. Joseph's Healthcare.